Hi everyone, this week's topic is autism spectrum disorder. Actually, I was planning to upload this last week, but there was a technical problem in my computer, so sorry for the delay. Firstly, we will briefly talk about the history of autism spectrum disorders. I won't go in details, but you can see that. Especially, Eugen Bleuer first uses the word autism in 1910, but in the history of autism spectrum disorder, we mostly know the effects of Leo Kanner and Hans Asperger. Leo Kanner firstly described the early infantile autism, and he has referred to the symptoms of autism, especially referring to the coldness, distance in those children, and some social communication skills. And Asperger has conducted a study of 4 boys, and he has concluded that they have some similar atypical traits of communication skill deficits in communication skills, and he also has added that with Kanner's propositions, the social communication problems in these children arouse from the poor skills in the relationship between parents and their children. You can know this, and actually you should know that from 1980 to present the studies on autism has increased, so we are more aware of the general characteristics of autistic people. And besides, you can just check these. This is the general historical flow of research on autism. Let's define it. Actually, autism spectrum disorder is defined as a complex developmental condition that involves persistent challenges in social interactions, speech and nonverbal communication, along with restricted repetitive behaviors. We will talk when we were talking about the symptoms of autism, but you should catch here that these people have some problems in their social interaction. They have some verbal skill problems. They have some deficits in nonverbal communication, which means using the mimics or body language, using it or reading it. And also you will see that there will be some restricted repetitive behaviors. Although autism has been a separate category under the Individuals with Disabilities Education Act since 1990, it and other similar disorders like Asperger syndrome as well are now typically collected under a broader term, autism spectrum disorders. Normally we were calling it just autism, but now we are referring to it as autism spectrum disorders. This is a spectrum. Also Asperger is involved under this spectrum as well, but we will just consider autistic symptoms, the nature of autism here in our class. And when we consider the symptoms of autism, as I've mentioned before, firstly you will see that there will be some deficits in their social communication and interaction behaviors. The basic symptom is making little or inconsistent eye contact. I either don't look or just look and pull back my eyes. Look at another place. This is not a consistent eye contact. And they generally tend not to look at or not to listen to people. They fail to respond to someone calling their names. I had my internship in Boğaziçi University, UVA, and there was a 4-year-old autistic child, Deniz, and I was on duty to get in individual communication with him. And when I was seeing Deniz, he wasn't hearing, or let's say not hearing, but he wasn't responding. He had no problem with his hearing. Even his parents had got suspicious if there is any hearing inability in this child. But when they went and the doctor checked, there was no problem about his hearing. But he was slow, and maybe he had difficulty responding to so-called his name. So since they were slow in responding even to their names, they have difficulties pertaining a conversation back and forth with someone. So these are mostly the social communication, interaction, behaviors and deficits of these children, okay? And you will observe that there will be repetitive behaviors. These are repeating certain behaviors and words. For example, Deniz was saying, bugün Deniz'in doğum günü, bugün Deniz'in doğum günü, bugün Deniz'in doğum günü, bugün Deniz'in doğum günü, bugün Deniz'in doğum günü. Okay. We were pretending or sometimes really preparing some birthday cakes with clays, with Play-Dohs in class during my internship, and either he was saying, bu Deniz'in pastası, bu Deniz'in pastası, bu Deniz'in pastası, and think that I was going there for internship each week. He was doing the same things, and he was saying the things I have repeated now each week. Okay, we are mentioning about such a repetition, not just once. Okay, and they may get upset by slight changes in the routine. Everything should be certain for them, and they are generally more or less sensitive than other people to sensory inputs such as light, noise, clothing, or temperature. What I will ask from you is to watch the video I assigned here. Actually, in your presentation there will be a video as hyperlinked to this headline, this title, and if you watch this video you will see how they are affected by what is coming from outside as sensory inputs. Okay, so I think after that video you will be able to understand them more easily. It is really interesting. And briefly, let's talk about levels of autism. There are 3 levels of autism, and if you work at a private practice or at a school setting, and if you will consult with a psychiatrist expert in the field of autism, you will see that they will tell you işte seviye 1 otizm, seviye 2, seviye 3 otizm diye. So these levels are important. At level 1, the autistic children have noticeable issues with communication skills and socializing with others. They have difficulty initiating social interactions. For example, they are not able to ask a child, shall we play football? Shall we play a game together? No, that you shouldn't expect it from autistic children. And level 2 autism include a more severe lack of both verbal and non-verbal communication skills, and this often makes daily activities difficult, like unusual or reduced response to social cues, communication or interaction. They don't read the communication cues coming from others. Okay, if you're angry at him or her, no, he won't understand it. Okay, lastly, this is a more severe lack of communication skills. They display repetitive and restrictive behaviors. Their movements are repetitive. Okay, they will feel great states and difficulty focusing their attention on a specific thing, and They will not be able to deal with all of those sensory input coming from outside, and as a result of experiencing a huge amount of stress, they will not be able to shift their attention to something else to relax themselves. Okay, so this is the most severe level of autism. Let's talk about causes. Of course, as we mentioned in our previous types of disorders, we still don't have very strictly named and clearly defined causes of autism as well. But since there are research done on the possible causes of autism, we will mention them. Okay, early speculative causal theories, as a result of newly done scientific studies, have altered to a more comprehensive view, let's say. You will see that, as Hans Asperger stated, there was a biological and hereditary basis for autism. And Kenner also speculated that the cause of autism was biological, but he noted that the parents of these children were not warm-hearted. So, remember our first lessons, okay? Do you remember that mostly parents, especially mothers, were kept responsible for their children's disability? This was the same in early causal theories. And actually the term refrigerator moms, most probably you have heard about it, arose from Kenner's explanation. And as a result, they defined that emotional refrigeration has been the common lot of autistic children. And Bettelheim conceived a theory that cold and unresponsive mothers, what is this, on the shoulders of mothers, they carry all of the things on their shoulders, but most authorities referred to the newly emerged term refrigerated mothers to call for the mothers of children with autism, proposing that the cold, socially distant mothers' children were developing autistic symptoms. Okay? And as I've mentioned before, it was common to blame parents for the problems of their children, especially the mothers. However, more recent research showed us that the direction of causation between child and adult behavior is a two-way street. Consider that you have an unresponsive baby. You cuddle him, you smile at him, but he doesn't do anything. He doesn't look at you, he doesn't smile. And maybe you have already witnessed, maybe you know from your courses, all the things parents expect from their baby child is to get some smile from him. But these children don't smile, don't look, don't respond, okay? And after a while, it is stated by the research that sometimes parents who were responsive previously start not to do anything affectionate because they know that they will not get any response from it. Okay? So this is reciprocal process. Consider this always. And today's causal theories still yet not know what's wrong with the brain in autism spectrum disorders, but the causal theories state that the cause is neurological but not interpersonal. So they are taking the load on from the shoulders of mothers, okay? And they posit that there is strong evidence that genetics plays a role in many cases. However, given the range of symptoms and levels of severity of autism spectrum disorder, it's a reasonable guess that no single neurological or genetic cause exists. Okay, but just briefly we will go through with these neurological bases and hereditary bases of autism spectrum disorders. It has been found that high incidence of brain seizures and cognitive deficits have been associated with autism spectrum disorders. Okay, and post-mortem studies and neurological imaging studies like PET scans, etc., have implicated that there are a number of areas of the brain which are affected in autism spectrum disorders. I don't want to go in very much detail which part, because there are lots of parts. Okay, in fact, because so many areas are affected, many authorities now think that autism is better conceived as a disorder of neural networks rather than as being due to an abnormality in one specific part of the brain. So instead of keeping a specific part of the brain, they posit that a disorder of neural networks cause autism. So there is some problem in the transmission of sensory inputs that is obtained from the outer world into the nervous system, and that problem causes problems to form motor reactions or sensory reactions as a reaction to what is coming from the outer world. Okay, so just know that this may be due to some problems in neural networks in the nervous system. And in addition, research suggests that the brain cells of individuals with autism exhibit deficient connectivity that disrupts the cell's ability to communicate with each other. So maybe you know from your physiology of psychology or neurology course, do you know have, I don't know, for psychology department, but under the scope of physiological psychology, we were mentioning about the communication within and among neurons, and they say that there may be some deficits in this communication among and within the neurons when we are talking about autism spectrum disorders nature. Okay, and also we can talk about genetic basis of autism spectrum disorders. And we have some scientific evidence that there is hereditary component. For example, some studies have shown that when a child is diagnosed with autism, the chances are 15% that his younger sibling will be also diagnosed with autism. Okay, these are some studies, but of course research has yet to identify all the exact genes involved. But we know that there is not a single autism gene, but multiple genes are involved in this process, and the same genes are not implicated in all people with autism. All of these information tell us that we need more and more and more research in order to determine specific causes of autistic spectrum disorder. Let's go on with the prevalence of autism. Actually, 30 years ago, only 4 or 5 children in 10,000 had autism. Or, since people didn't know about its nature, maybe they were not recognizing it or identifying or diagnosing it with autism. Okay? But today, 1 in every 54 children has been reported to have autism. And according to the guesses, scientific guesses, 1 in every 2 children will experience autism in the next 20 years. actually not scientifically based. We as practitioners in the field of psychology or psychological counseling, we have some speculations on this prevalence, okay? And of course these are not scientific based. But children who don't have any stimulation, any physical, sensory, emotional, social, psychological stimulation in their environment, have more tendency to develop autism. Children who are not played with, who have been exposed to TV, tablets, only those stuff, tend to develop autism. Interestingly, based on my experience, and I'm repeating again, these are not scientific findings, but my experiences out of my practice. Children of older aged parents tend to develop autism because, or if those older parents have difficulty playing with their children, okay, you can guess that they may not have the energy to play with them. These are our guesses. Let's see what will happen in the future. Okay, what about the identification? Okay, there will be some long information here, but briefly I will skip them. The diagnosis must generally be done by a psychiatrist. The criteria reported by APA should be followed in order to diagnose autism. But at the basis, what you will do, what anyone is gonna do, is to observe the child. What will I observe? I will observe communication skills, social interaction. I will observe if there are any repetitive or stereotype patterns of behavior. Is there any eye contact? What about parents? Are parents able to set up eye contact? Are they looking into your eyes? Are they able to verbalize their needs, their feelings, their thoughts? I'm emphasizing the feelings part here. What about the abilities of parents in terms of expressing themselves? Okay, and also parents and teachers are asked to fill out behavior checklists, and these checklists also include items. Does he set up eye contact? Is he able to make some friendships? Is he able to talk with you? Is he looking at you? What about his verbal abilities, etc.? But we have two standardized instruments which are used in clinical setting: the Autism Diagnostic Observation Schedule and Autism Diagnostic Interview Revised. Use both of them, okay? As I've said, all focus on the general characteristics of autism, and what you need to do is to be a really good observer. If you are gonna work in the practice part of psychology, special education, psychological counseling, whatever, you should be a really good observer. And if you want to be in practice, start now by practicing observing people, everything, okay? Being a good observer is an important thing. Okay. Yes, this is important. Most children with autism can be diagnosed by the age of 3 years and sometimes earlier. And don't forget that we had talked in the classroom that parents are the experts of their children. And here, before formal diagnosis, most of the times parents are already aware that there is something wrong with their children even before the age of 3. And if you are working with a young child, you are in a preschool setting, you observe some deficits in child's verbal abilities, communication abilities, check out for the indicator if there is some loss or regression in babbling, speech or social skills in a young child. So why most of the parents and practitioners get worried about some delays in verbal communication is because of this. Because when we are talking about autism spectrum disorder, most generally a deficit in verbal abilities come through with it. And since we are talking about this autistic regression, they say that this range from about 20 to 47% of cases of children with autism, and portions of children with autism mostly have reported that they progressed normally for about the first 2 years, but then abruptly began to regress in behavior. So you will also follow if there is any regression in already achieved abilities or not. And let's go on with psychological and behavioral characteristics of autistic children. We already noted that these children have some deficits in social interaction and communication. They have repetitive patterns of behavior, and they also, in addition to these, they may display cognitive deficits, and they may have abnormal sensory perceptions. And we should talk about impaired social interaction, but already I mentioned these while I was talking, so I will quickly mention these. So as you can guess, they will have some deficits in social responsiveness. They will not respond to being picked up or cuddled. They may not smile, or they may laugh at things when nothing appears funny. Their eye gaze often differs significantly from that of others. They either avoid eye contact with others or look out of the corners of their eyes, not directly to the eye. Okay? They are mostly preoccupied with objects but show no interest in other people. They might not learn to play normally. So generally you will see that their plays will be repetitive as well. And they will not form expected parent or friendship relationship. Okay? They will have impairments in communication. They will lack communicative intent. They will not have the desire to communicate for social purposes. Mostly they are mute. They almost use no language, if in especially severe cases, level 3 autism children. This is an interesting symptom that they will show some abnormalities in intonation, rate, volume, and content of their oral language, almost done type of. Okay, you will say that their intonation, rate, and volume of their oral language will not be what we call so far in the normal spectrum, under the norms we expect from their peers. And their speech sounds will sound robotic. Okay, and they may exhibit echolalia. This is parroting what they hear, parroting what they hear, parroting what they hear, parroting what they hear. They will repeat it. Okay, they may confuse some pronouns, confuse you and I, or refer to themselves as he or she. For example, in Deniz's case, Deniz was saying, not I want to pee, but Deniz wants to pee. Okay, these are the symptoms. Okay, I think this joint attention is important. Joint attention is the process by which one alerts another to a stimulus via non-verbal means such as gazing or pointing. For example, one person may gaze at another person and then point to an object and return their gaze back to the other person again. In this case, the pointing person is initiating a joint attention and trying to get the other person to look at the object. Okay, if the other person is also reverting his or her attention to the referenced object, then this means he is responding to the joint attention. But this is not the case for autistic children. They are not engaging in joint attention. They are not following it. They are not responding it socially. Okay, this will be a good indicator in order to diagnose a child with the autism. Good symptom. Actually, we had mentioned about these, but let's again go through these. Okay, they will display stereotype motor or verbal behaviors. I had given some examples for this, but let's also talk about ritualistic motor behaviors. They twirl, they spin objects, this is a very frequent one. They flap their hands. Okay, this is a very common indicator. They play ritualistically with an object for hours at a time, or show excessive interest in objects of a particular type. Maybe they like watching washing machine working for hours. They become upset by any change in the environment. I had told that they don't like any changes in routine. And we have this impaired cognition as another symptom, as another characteristics of autistic children. They may display cognitive deficits similar to those of people with intellectual disabilities. They may display difficulty in coding and categorization of information. And interestingly, they seem to remember things by their location in space rather than concept comprehension. Okay? Shopping means going to a particular store on a particular street. They are not able to generalize it to another street, to another shopping mall, okay? Only to a specific thing. And here we say that they may have impaired cognition, and especially in coding and categorization of information. But don't forget the term our concept-wise exceptionality. They may be twice exceptional. They may also have something gifted in them. So, my question here to you, which I want you to answer under comments part in the video, is this. Firstly, do you have anyone with autistic spectrum disorder? What are his or her symptoms you observe? And the second one is, there is this autistic giftedness concept. For example, I don't say this to many people, but I was defined with autistic giftedness with one of my doctor colleagues. I'm counting the letters in a word or in a sentence. For example, when we are saying impaired cognition, I can immediately say that there are 17 letters in impaired cognition. Okay, and they told me that this is like type of autistic giftedness. But I don't have any social communication problem, but this is like repetitive counting. Okay? Repetitive behavior part, a symptom of autism spectrum disorder, but also I have the ability to see an 8-lettered word at one glance. So this is a giftedness. So explore in yourself. This is the second question. If you have any autistic characteristic, being sensitive to too much voice, okay, these don't make us autistic. But what about symptomology? And try to figure out, if you have such a characteristics, how does it affect your life? Try to explore it. If you can do it, you will understand how an autistic person experiences this life as well. And lastly, we know that autistic children, autistic people have some abnormal sensory perceptions. We had mentioned this before, but let's go on again. They are either hyper-responsive or hyper-responsive to particular stimuli in their environment. For example, some of them experience hypersensitivity to visual stimuli. You will see it in the first video I've shared with you, such as being overly sensitive to fluorescent lights. Another can be overly sensitive to touch. Maybe you have it. Just explore yourself. Or some are totally the opposite of hyper-responsive, rather very unresponsive to auditory, visual or tactile stimuli. They won't even realize it. They won't even notice it, okay? Okay. For treatments, I don't want to go in details because it is very it will be really under the concept of special education professionals, but know that there is no specific medication for autism spectrum disorder. Some medications are just used to reduce distressing behaviors. For example, if an autistic child or person is experiencing lots of anxiety, in order to reduce that stressing condition and the feeling and the tension, some SSRIs are assigned to those people. Actually, under the scope of special education, if you want to work with an autistic child, it should be one-to-one. You sit face to face, and if you are working, setting up eye contact, each time the child catches your eye, the pupil, you give him something reinforcing. This may be a raisin, this may be a candy, but we don't want candies too much because they are unhealthy. Mostly we give raisin, or maybe a nut, an emoji, etc. each time. And while working with these children, we are mostly utilizing from behavior techniques, behavioralistic approaches, and rewards and reinforcements are the mostly used instruments in terms of developing some social and communication skills in these children. Okay, and when we generally check education programs in both worldwide and Turkey, we see that individualized education programs are prepared for autistic children. Remember we talked about levels of autism? So in these IEPs, those levels of autism are very important in terms of determining your goals for that specific unique child. And also, schools have some school community toolkits, and in order to support the student with autism, especially his or her learning in a general classroom, they are supported, and there's a school community formed in order to follow the developmental level, developmental process of the autistic kid, and the schools are given information about the process of autism and how they can act together as a whole school to intervene to that autistic child. Okay, and in Turkey we have inclusion studies. These children are included into the general classroom settings, either full-time or part-time, based on the level of their disorder. But this requires too much work, too much effort, too much patience, and mostly, especially in public schools, these children are not catched very much. Anyway, okay, there are 2 programs and guidebook in Turkey. I shared their links with you. You can check them. And here you will see the foundations in world. If you're interested, you can search for them. And in Turkey we have, you mostly know I guess, Tohum Otizm Vakfı, Anadolu Otizm Eğitim ve Mücadele Vakfı and Autism Vakfı, but the most popular one is Tohum. Here in this slide, you see this slide is empty, but I will also share the slides with you. There will be a video, a song which has been conducted for autistic children, so maybe it attracts your attention. Thank you. You have 2 questions. Try to answer them, and don't forget that this week we will have debate on autism's nature. Is it a disability or diversity debate topic on Thursday? So please do your best while evaluating your friends' debates on discussion forum. Take care, stay healthy, see you soon, bye bye.